Well, the White House COVID response team is talking about new ways to combat multiple coronaviruses while saying we're not in the clear yet with the pandemic.
The National Institutes of Health has spent billions of dollars since the start of the pandemic. Much of that money has gone to vaccine studies. Dr. Anthony Fauci says one long-term project is looking at a universal coronavirus vaccine. But White House experts stress the vaccines we have now are effective. And while we're in a better position than we were a year ago, they say the pandemic is still a threat.
When you have over 2,000 deaths, 150,000 hospitalizations, and you have people who are now getting infected to the tune of somewhere around 700,000 a day, we're not there yet.
Public health experts detected a new Omicron subvariant, and right now they're studying its impact. So what exactly do we know about this emerging subvariant?
Yeah, let's talk tonight live with Dr. Dean Blumberg with UC Davis Health. Doctor, it's always great to get your input on this. So, okay, let's talk about, we heard about the Omicron around Thanksgiving, and now we're hearing about this subvariant. People are like, okay, what does this mean? How bad is this? And are you even surprised by this?
Well, these variants are always going to come about as the virus continues to be transmitted and replicate. We're going to get mutations, but then it's difficult to put them into perspective. With this variant, it was first discovered around Christmas. It's got 28 different mutations from the original Omicron strain, BA1. It's got 32 mutations that are similar to BA1, but this BA2 has really increased in Denmark, Norway, Germany, South Africa, India, and the Philippines. And in Denmark, it accounts for about 50% of the circulating strains.
So from what we've seen so far, do we know whether this is affecting some groups of people more than others?
Well, one of the concerns in Denmark, where it is becoming the predominant strain, is that the highest rate of hospitalization is occurring in children from birth to 2 years of age. The second most affected group is those over 80 years of age. So we haven't seen that before. And as a pediatrician, that deeply concerns me.
So why is this subvariant, this Omicron subvariant, getting so much attention? What's the big deal with it?
I think because it's increased so rapidly in so many cases, and we haven't seen the leveling off like we've seen here in California, in some of the countries where this has been detected, such as Denmark and such as Israel, they're still seeing skyrocketing rates of cases. And so the concern is that it may be 40% more transmissible compared to the previous Omicron strain.
Wow, which, as we know, spread really quickly around the globe. I guess it's, people may be wondering, is it normal for these subvariants to emerge and for them to be this contagious? And I don't even know if there is a normal right now. All of this is pretty new.
Yeah, I would agree with you. It's like hard to know what normal is in the age of COVID, isn't it? We keep getting surprised. We keep getting these mutations. I think until we get a high rate of immunity around the world, we're going to continue to get development of new strains, new variants, and new surprises.
So let's just, I have a very close loved one who just went through getting COVID. Pretty sure they had the Omicron variant. So because of that, does that mean that they have the natural immunity to this new subvariant, or is it like, here we go again, you could have another infection?
There's already been reports of patients who've been infected with the original Omicron strain and then within a month getting infected with this strain too. So there is some suggestion that it's different enough from the previous strain that it's possible that previous infection-induced immunity may not provide that much protection.
Another question that I think comes up given that is, what is really the difference when we have a new variant from a subvariant, if this is that different from the Omicron variant?
Yeah, some people have called it the stealth variant, and others, I think that's a very poor name. We can detect it with our currently available diagnostic tests. So whether this does end up being a separate variant, whether it does get a new Greek letter, we'll just have to see what the World Health Organization says.
All right, Dr. Dean Blumberg, it's great to get your expertise. Yeah. I can't wait till we can stop bugging you all the time and getting this expertise, but great information.
That
Thank
would be
you.
Great.